the alignment between the hindfoot and the forefoot, you can see that just the way she's hanging, she's naturally got a little bit of an adducted forefoot. So when I cast her, I want to try and make sure that I'm actually abducting the hindfoot, or pardon me, the forefoot, so that this line is straight. So now the midtarsal joint goes from being slightly adducted to abducted, and so when I load, I'm going to make a special attempt, and well, I'll succeed in this, but I'm loading the 4th and the 5th at the sulcus on the angle of the sulcus, and I'm also going to plantar flex the 1st so that this doesn't end up here showing a false forefoot varus. So maybe you can just bring the camera up and look down on top there. So you can see just by loading it like this and bringing it into a neutral position, there's a better forefoot to hindfoot relationship, and I definitely don't want the forefoot to invert this way, but I want to make sure that I plantar flex it. Alright, so have you bring the camera right over the top here. So when I put this first strip on, I'm going to put the first strip on 2/3 over this side, 1/3 on the lateral side, but I start here, and the strip is perpendicular to the line on the heel. So when I bring my fingers down from the top side, I've got 2 fingers on the top side plantar flexing the first ray, and I've got my other finger on the bottom side of the hallux to dorsiflex it, so that it keeps a desired angle at the first ray. I don't want this to happen. I want to make sure that her hallux is always dorsiflexed, and that aids in plantar flexion of the first ray. Not, you know, rough plantar flexion or hard plantar flexion, but just to make sure that it's not dorsiflexing. Alright, so again, sweeping all this off and taking all the wrinkles off. Now just let your foot totally relax there, Sharon. That's great. And bring this over, sweeping. And again, always trying to make sure with these fingers here, I'm always, you know, slightly plantar flexing that first. And all the wrinkles are out. And here's the second piece. Okay, so we start from here, right on this edge, continue it, taking all the wrinkles out. And now this is going underneath the sulcus, and very loose at the toes, because I don't want the plaster at the toes to cause the toes to buckle into dorsiflexion. So again, using my thumb here on the 4th and the 5th, I want to make sure that that's loaded. And then I use a piece of paper towel here, because trying to hold this without paper towel is like trying to take a hook out of an eel. Very hard to do. And only a fisherman would know that. So again, I don't have the lines to look at, but the end result will tell. So my thumb only goes as far as the 5th and the 4th, and it's not perpendicular to the toes, it's on the same parallel line with the toes in the sulcus, and then I'm slightly plantar flexing the first, and I'm going to check to make sure she's in subtalar neutral, which is right here. And again, so I have 2 or 3 fingers on the top side of the first ray, and then my baby finger is on the bottom side, ensuring that the hallux is actually slightly dorsiflexed. I don't want this position of plantar flexion of the hallux. I want it dorsiflexed, and then I hold that position right there, and I keep checking it. Subtalar neutral, and first metatarsal. She doesn't have what I call a super plantar flex first. So as you can see, there's not a lot of action that happens during this time. Constantly check it. And as I say, the fourth and the fifth are in the sulcus and not against the metatarsal heads. And you know, I have to sort of configure myself relatively to the foot rather than me trying to put the foot in comfort to me. Right. So you can see that the forefoot to hindfoot relationship is pretty congruent. She doesn't have a supraplanar flex first or a planar flex at all, so there's not much difference between here and here relative to the hindfoot. So that's hardening up pretty well. So as it's hardening up, but not quite hardened, what I do here is open up the toes, being really careful not to pull apart the plaster. So I leave it fairly tight there, and on this side, on the medial side, what I'm actually going to do is put my fingers here to stabilize the arch in the first metatarsal, so that when I open up the plaster up front, it's not deviating the arch here on the medial side. So now it's loose enough so that when I take it off, it'll just slide off like a slip-on shoe, like a loafer. And then the lotion that I put on makes a big difference. How are you holding together, Shannon?
Great, thanks.
Good. So just to review, while the foot's in a subtalar neutral, I'm dorsiflexing the fourth and the fifth column, and there's a slight abduction to make sure that I'm not pulling the forefoot this way. At the same time that I'm, with these three fingers, planar flexing the first ray and using the baby finger to dorsiflex the hallux to make sure that it doesn't pull down this way. So when you set the cast down, it should be a three-point cast, here, here, and here. And if it's sitting, if this is the lowest point, then you've probably got an arch that's malformed by the casting. And that should do that.